The Australian Financial Review.
At the AFR Health Summit this week, the Financial Review's Michael Smith put his panel of private hospital operators and health insurers on the spot.
Sadly, we're out of time, but I'll sneak in a cheeky last one. One sentence answer from all of you. Should private equity be able to buy critical health infrastructure such as hospitals?
No, it's been a disaster.
These two groups hardly ever agree, but on this question, they were unanimous.
I think we're moving into a dangerous territory with private equity. I think the trouble is it's started now, and how do we make sure that we don't lose the system in the middle of it all?
This candid exchange took place as Australia's second biggest private hospital operator is in the middle of a takeover battle. Healthscope is struggling under a mountain of debt, and its private equity owner is looking to sell out. Healthscope has been lobbying the federal government for extra funding and to force health insurers to pay more to hospitals.
Australia's second largest private hospital operator, Healthscope, launched an extraordinary attack on private health insurers this week, claiming some of them are not paying their fair share to hospitals.
There is concern this could all blow up as a political issue at exactly the wrong time for the government. The last thing the Albanese government needs in the middle of an election campaign is failing hospitals. Welcome to The Fin. I'm Lisa Murray. Today, health editor Michael Smith on the battle to save Healthscope, the war between insurers and hospitals, and whether private equity is messing up the healthcare system. It's Thursday, April 10. Thanks for coming on the podcast, Mike.
Thanks, Lisa. It's great to be here.
Mike, how does Australia's healthcare system work? Who owns and runs the hospitals?
Australia's got this quite unique healthcare model that works much better than it does in a lot of other countries, particularly the UK and the US. And we've got this mixture of public and private care, and particularly in the hospital system. So the private hospital system's a huge part of the Australian healthcare system, counts for 60% of elective surgery. You have to have private health insurance to pay for it though, but 15 million Australians now have private health insurance. It's at record levels, so this is more than half the population. So it's a really integral part of the system. So there's about 600 private hospitals across the country, and they have a mishmash of different owners, everything from a single person to the not-for-profit hospitals, many of them owned by the Catholic Church, to the really big hospital operators. So the biggest one's Ramsay Health Care. It's a big ASX-listed company. They have 76 hospitals. They're actually quite profitable. The second biggest is Healthscope. So Healthscope has 38 hospitals, and they're doing it really tough.
Before we talk specifically about Healthscope and its challenges and the fact that it's in the middle of a takeover battle, can you tell us about the wider war going on between Australia's hospitals and the health insurers over who pays for our healthcare system?
That's right. So health insurance and private hospitals have this symbiotic relationship. So the health insurers actually fund the hospitals because they're paying for their members to go to a private hospital when they get sick. So they both need each other. They don't really like each other. And there's a lot of tension between the two at the moment over funding. So before the pandemic, there was it's a very cyclical industry. There was this period where insurers were losing a lot of money, not doing very well. And it was actually the hospitals that were doing well and making quite a lot of money. Now, this all shifted during the pandemic, and that's for a number of reasons. So when COVID hit, of course, no one was going to hospital for elective surgery.
In less than 6 hours, all elective surgery, except for very urgent cases, will be cancelled.
Everyone was staying at home and putting that off.
With a growing number of hospitals deferring non-urgent procedures as the health system buckles.
So the hospitals was almost empty for many months, but the insurers were still getting paid. The insurers did have to tip some money into this fund to keep everything afloat, but they did quite well during this period. So after COVID ended, everyone was out again and going back to hospital, but you didn't see the bounce that you'd expect. Now, this was partly because the cost of everything increased. This happened all around the world. Staff wages, particularly nurses' wages, are still going through the roof. General inflation, the cost of buying medical equipment. It was harder to get staff. So hospitals were sort of encountering this new problem of soaring costs. And at the same time, fewer people were actually using private hospitals. So the model of care sort of shifted a bit. Improvements in clinical care often mean people don't need to go to hospital for as long. They don't need those really long overnight stays. So, for example, if you go in for a knee replacement, 5-10 years ago, you might be in hospital sort of 5 or 6 nights. Now you're out much quicker, maybe 2 nights. So people are doing more care in the home, more day surgery. So that's sort of cutting into hospital operators' revenues. And then even if you've got insurance, there's still often out-of-pocket costs when you go to a private hospital. So during a cost of living crisis, a lot of Australians are actually just skipping this and going to public hospitals instead because it's totally free. And we're sort of seeing this play out, particularly in areas like maternity, where if you're having a baby, people might go and do that in the public system now. So hospitals are really struggling. But at the same time, the health insurers are actually quite profitable because a record number of people have private health insurance and, many of us aren't really happy with the high prices we're paying. So now there's this sort of massive war going on between the insurers and the hospitals are putting pressure on the private health funds to give them more funding.
First in breaking news, Australia's second largest private hospital operator is set to terminate its contracts with 2 major private health insurers.
It is a dramatic escalation in a stoush between hospital operator Healthscope and major insurers, including Bupa.
And this is the backdrop for the battle that's going on over the future of Healthscope, which, as you said, is the second biggest hospitals operator. That's a company in a battle you've been writing a lot about in recent weeks, a lot of front page stories. Tell us about Healthscope.
Yeah, Healthscope's a really interesting company. It owns 38 hospitals all around Australia. It's got hospitals in Darwin, Hobart, and a lot in Sydney and Melbourne. It used to be a listed company, but in 2019 there was a bit of a bidding war for it, a lot of interest, and eventually it was sold to a Canadian infrastructure company called Brookfield Asset Management. Brookfield's since moved its headquarters to New York, but this is a huge global asset manager. It has $1 trillion worth of assets, and it's sort of basically a private equity firm. And look, they invest in everything from mortgage brokers to power companies. They have made bids for even companies like AGL and Origin in Australia. So they invest across a lot of assets. But I think it's fair to say Healthscope might be one of their worst ever investments. People say Brookfield overpaid. They paid $4.4 billion at the time, and they took on a huge amount of debt. But they also did what's called a sale and leaseback. So they sold a lot of the property, 22 of their hospitals off, and then they rented them back. Now, after they did this, COVID hit and the whole world changed. Their business model was broken. No one was going to hospital for elective surgery. And remember, throughout this whole time, they were still having to pay rent on these hospitals that no one was using. So the property ownership is where David DePilla comes in. Healthscope sold 11 of their hospitals to one of his real estate investment trusts.
And Mike, explain who David DePilla is.
Yeah, so David DePilla is a bit of a legend in the Australian business world. He's a former UBS banker, a very well-known deal maker who went on to set up his own business called HMC Capital. He's quite ambitious. He's been behind some very big deals in Australia. He was a key player in the $8 billion Chemist Warehouse sort of backdoor listing with Sigma. And he's invested very heavily in data centres. So at the same time, Healthscope also sold another 11 of their hospitals to a Canadian property group called Northwest.
So it sold 11 to David DePilla's Real Estate Investment Trust, and it sold 11 to Northwest.
That's right. And it's got a handful of its own hospitals. Some of those are public-private partnerships with governments, but most of it has to pay rent on. So because they sold all those other hospitals, they're paying quite high rents, and those rents are no longer sustainable in the current operating environment. So that's sort of added to all of Healthscope's other problems. We haven't seen their latest results, but the last public results were from 2023. They had to write the business down by $919 million. They lost $649 million in that year. So it's pretty safe to assume their financial performance for 2024 is going to be a lot worse when we eventually see the figures later in April. So they've been on this sort of mission. They've been behaving quite aggressively. Brookfield and Healthscope have been pushing health insurers to give them more money. They've also been lobbying the Australian government to bail them out and help them out. That hasn't gone down so well in Canberra, and they've been pushing their landlords to lower their rent or give them a rent holiday. So they have, the key to all this is their debt. So Healthscope has $1.6 billion worth of debt, and that's shared over a lending syndicate of 27 organisations, mainly banks. It includes the big four in Australia and also a lot of foreign banks. So Healthscope sort of hit this point where they've got to renegotiate their debt, and that's what's sort of triggering this crunch point. They've got until mid-May to come up with a deal with their lenders. So because of that, David DePilla has said that HMC Capital wants to put together its own consortium to bid for the whole company. Now, a lot of people are saying hospitals are really bad investments. DePilla's betting on the long-term demographics. We have an ageing population. He believes there's plenty of growth potential in hospitals if he can do the right capital deal. But sort of one of the real reasons he's doing it is to protect his own real estate interests. His own investment trust owns 11 hospitals. He doesn't want them to shut down. He doesn't want to lose all that rental income if Healthscope were to collapse.
So on the one side, there is David DePilla with his 11 hospitals who's looking to put together this consortium to make a bid. But on the other side, as we heard from your reporting last week, Mike, there's a group of overseas hedge funds that have been buying up the debt in Healthscope to give them a seat at the table. So where is the takeover battle up to?
Well, once David DePilla declared his interest in Healthscope, Brookfield have gone out and launched their own sale process, which is something you'd expect them to do. They obviously want to drum up a bit of interest, get as many bids on the table as they possibly can to get a price. So that process is underway. That's due to be completed in the middle of May. They've appointed advisors, and it'll be interesting to see who emerges as a possible rival bidder. Now, Healthscope has this agreement with about 70% of its lenders. It's called a standstill agreement, and this means those lenders have agreed not to sell the Healthscope debt until the middle of May. Now, they've done this to give Healthscope sort of more time to find a solution to its mess. It could be finding a bidder. It could be finding a way to recapitalise the business. So that gives them a little bit of breathing space. But not all the lenders agreed to this, though 30% of the debt can still be traded, and that's more than sort of $400 million. So the AFR learnt last week that some overseas hedge funds have been buying some of this debt. And the reason this is very interesting is that those hedge funds are buying this with the likely intention of breaking up the business. They could keep the so-called good hospitals, or they might want to sell them, but the bad hospitals, they're unprofitable. They would probably just shut them down. So, Lisa, this threatens to become a real problem for the government at exactly the wrong time. The last thing the Albanese government needs in the middle of an election campaign is a health crisis, but with a cloud hanging over one of the country's biggest hospital groups, and this raises the real risk of closures. A health crisis is exactly what they might get.
Mike, we're talking about the battle to save Healthscope, the country's second largest operator of hospitals. There's some concern that this could blow up as an issue during the election campaign. We have a vote coming up on May 3. Why is this such a big issue for the Albanese government?
Yeah, healthcare's been at the centre of Labor's campaign.
Only Labor has a plan to strengthen Medicare.
They want to make sure healthcare costs for Australians are lowered.
We've got more doctors, we've got more bulk billing, and we're opening more Medicare urgent care clinics.
And they're mainly doing that through bulk billing and cheaper GP visits and investing in Medicare. But they're really concerned that more hospitals are going to close. So quite a few private hospitals and particularly maternity wards have closed already. And the government doesn't want private hospitals closing because it means those patients are going to sort of all pour into the public system, which is already at breaking point. And then it's a real issue in regional Australia. If your local private hospital closes, you might not have anywhere to go. But the government's hands are a little bit tied here because they're private companies, so politicians can't really bail them out. Last July, because people were so worried about private hospitals, Health Minister Mark Butler decided to set up an inquiry into the viability of the sector. So he got the health department to do this 4-month probe. They released a report at the end of it, but it didn't really come out with any recommendations. It sort of showed hospitals were in a bit of trouble. Instead, he set up this thing called the CEO Forum. So they got the CEOs of all the big hospitals, all the big health insurers to sit down and meet every couple of months and sort of try and work out a solution to all these problems. But
do they ever have a solution? Do they ever announce what comes out of these meetings?
Well, that's the problem. And I've spoken to a lot of people, who go to these meetings and they all say it's been a bit of a waste of time. They just can't agree on anything.
Mm.
So the hospitals think Labor wants to be seen to be trying to do something, but it doesn't really want to do anything, and it all wants to sort of slide until after the election. Mark Butler was actually at the AFR Health Summit this week.
We know that private hospitals are falling over, struggling to stay afloat. Can you elaborate on what your plan is to actually help fix this?
So Butler said he's really worried about the private hospital sector.
I think there needs to be a lift in the benefit payments ratio from insurers to hospitals. I want them working on that urgently. I imagine insurers are going to have their own issues that they want to put on the table about reform of the sector as well, and I think that is entirely legitimate.
But it's sort of flashing as a bit of an issue that if the hedge funds got hold of Healthscope, they could just ditch the bad hospitals, close them all down, then keep the good hospitals. And this would be a bit of a disaster for everyone. And it'd be particularly a disaster for Australia's healthcare system. And the government apparently is privately quite worried about this.
Mike, do you think private equity firms are the right owners for critical healthcare infrastructure?
Yeah, it's a really tough debate, and it's one that's now warming up in Australia. The problem is the healthcare system really needs the capital, but at the same time, I think the Healthscope situation has highlighted the fact that, private equity want to come in, cut costs and make a return. And that's okay for some industries, but it's tricky when it's critically important infrastructure that's responsible for the health of millions of Australians. There's been a lot of media coverage about one of Healthscope's hospitals in Sydney, Northern Beaches Hospital, which is a public-private partnership with the state government. A young child died there last year, so there's been an inquiry into that.
There are more shocking reports tonight of another baby death at the embattled Northern Beaches Hospital.
The embattled leaders of Healthscope led with an apology.
My deepest condolences to the Massey family for the loss of your baby boy, Joe, and for the care that Joe did not receive.
This issue's really on the radar for politicians now. So, Lisa, there's some high-profile examples of private equity-backed healthcare deals which has sort of really gone wrong. So one of those is Genesis Care, used to be one of Australia's most promising healthcare companies. It was this big global group worth more than $5 billion at its peak. But in 2023, it went into bankruptcy in the US. I think it had $2 billion worth of debt. It was using that money to try and expand into the North American market, and it just didn't work out. So that's sort of a an example of a big Australian company that got mixed up with private equity. But in the hospital space in the US, there's a company called Steward Health. So that owned more than 30 private equity-backed hospitals, but it got into a lot of trouble. So its CEO and investors reportedly siphoned hundreds of millions of dollars off from community hospitals, and it had, one of the worst patient care records in the country. So this sort of sparked this huge political debate in the US about private equity and healthcare. So it is something the countries around the world are grappling with, and I think you're going to see a lot more discussion around this in the future.
Mike, David Di Pilla is putting himself forward as the good guy in this deal story. He's come out and he said he wouldn't break up the hospitals. He'd keep Healthscope together. So would it be better for Healthscope and Australians in the healthcare system if David Di Pilla was to be successful?
Yeah, look, that's still not quite clear. Everyone's trying to work out his agenda. I mean, he obviously sees huge growth potential in hospitals, particularly as we've got this sort of ageing population, a growing population. But there's a lot of tension for him bidding for Healthscope, and that's because of the sort of complex nature of all his investments. So his real estate investment trust, we use the acronym HCW, that owns the 11 hospitals. And those hospitals account for 70% of that trust's revenue. So this is very important to the unit holders in that trust. HCW was listed on the stock exchange in 2021, and David Di Pilla's HMC Capital, and sorry for all these acronyms, means the parent company gets paid annual management fees. It also owns 22% of the shares in this fund, but the rest of the shares are just owned by other unit holders, and it's in their interest that the Healthscope rents stay high for those hospitals so they get more revenue.
So I think it's important to understand this, Mike. So David Di Pilla's real estate investment trust, HCW, it's the entity that owns the 11 hospitals.
That's right.
Right.
So HMC Capital's the parent company.
Yep.
This trust, HCW, is kind of like a satellite company. It's a bit of a spin-off that Di Pilla partly controls. That's the entity that owns the hospitals.
So it's in their interest for rent to be high because then they get more revenue.
That's right.
It's in their interest for Healthscope to survive because then they get the revenue. But if HMC Capital were to own the whole business, it would be in its interest for the rents to be low so that the business is making more money.
Exactly. So that's a real conundrum here.
Yes.
David Di Pilla will be effectively negotiating rent against himself. But, Di Pilla's also a bit of a master of doing deals, pulling a rabbit out of the hat, and people close to him say there's always a way to structure these deals to avoid a conflict of interest, but we still don't know how that might play out. At the same time, he could be up against other bidders, and I think we've really got to consider Ramsay Healthcare here. Some people say they could potentially buy the whole business. There might be some competition issues, or they might want to pick off the hospitals that they want. So I don't think we should discount them here.
A final question then, Mike. A year from now, what do you think will be the fate of those hospitals, and what does that mean for all the Australians who rely on the healthcare system?
I think we are reaching a bit of a crunch point in mid-May, so that may come after the election, but you never know in a situation like this. And I think the only thing that's really clear at the moment is that Healthscope's on life support and there's going to be some kind of ownership change. So Di Pilla has a reputation, as I said before, sort of for pulling a rabbit out of the hat and surprising us all and pulling off even the toughest deals. So, he could do anything in coming weeks. It isn't quite clear yet who he will be competing against or how he will structure a bid that keeps all his investors happy. So either way, Lisa, the situation facing Healthscope sort of highlights the challenges facing the entire healthcare system in Australia. So on one hand, you have this very challenged private hospital system, and I'm sure many of our listeners do rely on that system. But if that fails and hospitals start closing, the only alternative is to go into the public system And that's under a huge amount of strain at the moment. Record waiting lists for elective surgery, huge ramping times, long waits for ambulances, and crowded emergency departments. So that's not an outcome anyone wants. We still want to have this choice. So I think the outcome for Healthscope here could potentially have an impact on all of us.
Thanks, Mike.
Thank you.
Thank you for listening to The Fin. I'm Lisa Murray, with Financial Review health editor Michael Smith reporting today. The Fin is produced by Alex Gow. Lap Fan is head of podcast. Fiona Buffini is head of premium content. Our theme is by Alex Gow. If you like the show and want to hear more, follow us wherever you get your podcasts and consider rating and reviewing us, as it helps others find us. And now that the federal election campaign is in full swing, The Fin is releasing a special weekly podcast. Every Tuesday, political editor Phil Curry and our other Canberra experts join The Fin to break down the big issues. If you want to send us in a question for the political panel, email thefin@afr.com. For more stories about markets, business and power, subscribe to the Financial Review at afr.com/subscribe. See you next week.
The Australian Financial Review.